Athlete's back pain is a little different than the general population. In fact, in three big ways it's different. So I broke those out for you. But first, just in case you're kind of wondering why the heck you should listen to this guy, well, I wrote a couple chapters in this book here with back pain. I was co-editor of this textbook here on medical rehabilitation. And then also more than just a model for the cover of this one too. This is all I think about all day. So I hope you have faith in the words I'm telling you here. To begin with, I broke it into three big buckets. The first one would be kind of mechanical or functional pain. So for these is less about the discs and the vertebral bodies above them and more about everything on the sides of those spinal columns, as well as all the soft tissue around it. We're talking about things like myofascial pain, like I was saying, facet issues. Facets are essentially, we have, two vertebrae where they're meeting. These small joints are the facet joints. Sacroiliac joint issues. It's a little overrepresented in terms of unproven diagnoses, but there's definitely some component of truth here. The next one is going to be more of a structural pain, and structural, again, I'm defining as closer to the midline. So that's going to be the vertebral bodies or the discs in between them. And those can cause a lot of problems if you are to herniate a disc, of course. So locally that causes what we call discogenic pain. The good news is when you herniate a disc, it actually can heal. The worse the herniation typically, the more the immune system recognizes it, sends in all the kind of cleanup team. And the last one being neurogenic pain, which is kind of self-explanatory. That's nerve-related pain. And this is what people are most worried about often: disc herniation, nerve impingement. Not always the case, not even frequently the case. Really about 10% of cases, give or take, are going to be these neurogenic type pain situations in the back. But the reason we worry about them as professionals and patients is that those can be more serious, of course, because nerves don't do well when compressed for any given amount of time.